for an extubation procedure, I'm going to receive and verify my order. I'm going to communicate my plans with the patient's nurse. I'm going to gather my equipment such as the suction catheter, the syringe, the scissors, and the oxygen delivery device for post-extubation. I'm going to maintain asepsis the entire time by putting on non-sterile gloves. I'm going to inform my patient what I'm doing, and I'm going to introduce myself as a respiratory therapy student. I'm going to place my patient in a semi-Fowler's position, and I'm going to complete a baseline assessment. I'm going to hyperoxygenate my patient, and I'm going to suction the trachea if indicated. And then I'm going to suction the supraglottic region and posterior oropharynx, such so for any secretions. And I'm going to dispose of this afterwards and apply the yanker. And I'm going to deflate the cuff and feel for any airway movement. And if there is, I'm going to re-inflate the cuff and proceed with the procedure. There should be some tape here, and we're going to pretend like I'm cutting it. I'm going to ask the patient to take a deep breath, and when they do, I'm going to deflate the cuff. I'm going to ask the patient to cough, and then remove the ET tube following its natural curvature. I'm going to then apply supplemental oxygen. Supplemental oxygen. And I'm going to encourage the patient to cough to provide so they can get their secretions out. And finally, I'm going to do an assessment and rule anything out. I'm going to check their heart rate, respiratory rate, blood pressure, SpO2, their general appearance, and their respiratory pattern. And then I'm going to inform the patient's nurse at the time of extubation and the tolerance to the procedure. I'm going to make sure to document everything. And then I'm going to evaluate any indication for bronchial hygiene or lung expansion therapy.